Welcome. Thank you so much for joining us today. I see we have folks trickling in. Really glad to see everyone from our community of practice joining us today. My name is Ali Gillespie, and I'm the Network Engagement Coordinator with the Refugee Self-Reliance Initiative. On behalf of the RSRI, I'm excited to welcome you to this session of our 12 months, 12 domains learning series, with today's event focusing on linkages between food security and refugee self-reliance globally. Again, folks will continue to trickle in, and I'll go ahead and do a brief introduction before we get started with our session for today. And before I actually introduce the session, I'd like to start by sharing some exciting news from the RSRI team. This week, we're really thrilled to welcome our brand new Executive Director, Francisca Vigo-Walsh. Francisca brings more than 2 decades of experience advancing protection for refugees and other displaced people across humanitarian contexts. And she has worked with refugees and other displaced people in operations and policy. To learn more about Francisca, check out our newest blog post at the link in the chat and on our website. Now back to today's event. Our 12 months, 12 domains learning series is designed to take a deeper, more intentional look at the Self-Reliance Index, or the SRI, by focusing on one domain at a time. For those unfamiliar, the SRI is a measurement tool containing 12 domains that focus on a refugee household's basic needs, resources, and sustainability, with a mind to understanding how self-reliant households are and how this shifts over time. Domains measure a variety of elements at the household level that play a factor in a household's ability to become increasingly self-reliant and to sustain that into the future. If you're interested in learning more about the SRI, you can access resources on our website or by contacting the RSRI Training and Technical Support Manager, Ned Meerdink. There are lots of ways that we can support your application of the SRI and your programming, and we're eager to help. This year, each monthly panel discussion is spotlighting one of the SRI's 12 domains. The goal is to move beyond high-level discussion and really dig into what each domain looks like in practice, what it means for program design, for policy, and for how we understand and support refugee self-reliance across different contexts. One of the core understandings of the SRI is that responses in all sectors can and should contribute to promoting self-reliance, and our domain by domain series in 2026 hopes to highlight that in detail. So throughout this series, you can expect focused discussions, practical insights and resources, expert perspectives, and real-world case studies from practitioners and members of the RSRI's broader community of practice. Together, these conversations are meant to support learning, reflection, and action, using the SRI not just as a measurement tool, but really as a framework for deeper understanding and more responsive programming. Today, we're focusing on food security and its role in advancing refugee self-reliance across diverse contexts, including resettlement settings, host country environments, and camp or camp-like settings. Within the SRI, the food domain gathers information about how many meals a refugee household consumed the day before, with a meal defined as including 2 or more food groups. And asking respondents to recall this information, the SRI aims to assess a household's typical food intake and its nutritional value. The tool also guides enumerators applying the domain to inquire if food consumption across the household is typically equitable, or if some members of the household regularly consume more than others, which is a common coping mechanism in households challenged with food insecurity. Understanding household food security can help practitioners to design programs and advocate for policies that strengthen refugees' access to food and quality of food. Today's webinar will explore such programs and policies and discuss how agency, culture, and other food-related factors can contribute to overall self-reliance. We'll begin with a presentation from Bilal Jajou. Bilal is an international policy analyst focused on gender equality, social inclusion, and capacity strengthening. With more than 20 years of experience across the Middle East, Sub-Saharan Africa, and Asia, he helps partners turn research into practical policies and action plans. He has worked closely with governments and development partners to translate evidence into strategies and implementation plans. Today, he will share insights on making food security responses more inclusive for displaced communities. After Bilal shares, we'll move to our panel discussion, where we'll hear panelists' insights from their work across different contexts, highlighting innovative programming approaches and policy efforts related to food security and refugee self-reliance. And we have a very exciting panel lined up today. The first panelist I'd like to introduce is Dr. Hala Gares. Hala is an associate professor at the Arnold School of Public Health at the University of South Carolina. Her research explores the links between inequity, food insecurity, nutrition, and health, especially in the Middle East. She studies both under and overnutrition in the context of the global nutrition transition and regional conflict. She also leads nutrition and health components of poverty surveys and evaluates programs addressing food insecurity, malnutrition, and chronic disease. Next, please join me in welcoming Paul Cato, the Executive Director of the Ladado Sea Community Self-Reliance Network in Uganda. He leads community-based efforts in Nansana and Kira to strengthen local food systems and livelihoods. His work includes climate-resilient agriculture, WASH initiatives, and evidence building to guide local strategies. He holds a degree in development studies with certifications in climate change and integrated water resources management. Our next panelist is Tenzin Manel. Tenzin is CORE's Technical Director for Cash and Markets. She supports teams to design evidence-based cash and livelihoods programs that help crisis-affected communities survive and thrive. Over the past 3 years at CORE, she has advanced cash and voucher assistance across multiple country programs. She previously worked with global organizations across several regions to strengthen programming for displaced and marginalized populations. And last, but definitely not least, our final panelist is John Francis Umusolo. John Francis is a regional market systems advisor for Mercy Corps, supporting programs across Africa. He designs inclusive market systems that strengthen resilience, livelihoods, and self-reliance in fragile and displacement-affected settings. He has extensive experience integrating poverty graduation approaches with market systems development, including in refugee hosting areas. His work connects smallholders and micro entrepreneurs to sustainable market opportunities with a focus on food security, youth employment, and climate resilient agriculture. We're very grateful to all of our panelists and speakers for sharing their time and expertise today, and to all of you for being part of this conversation. We encourage you to engage, reflect, and think about how the ideas shared today might apply to your own work and context. And some final housekeeping notes. Please introduce yourself in the chat box if you haven't already, and add any questions that you have during the session to the Q&A box. Captions are available in multiple languages. To access them, turn to the Zoom menu on your screen, select Captions, and then select your speaking language. With that, I am pleased to kick off our 12 months, 12 domains webinar on linkages between food security and self-reliance. And I'll now turn it over to Bilal Jaju for a presentation on hunger and displacement globally.
Hi, everyone. Thanks, Ali, for the beautiful presentation for us. It's really glad to be with you for this beautiful initiative and advocacy over the 12 months. Yes, just a second to see my presentation here. Yeah. So I will not take much time. It's just about 10 minutes to make an overview on food security. A little bit. So what you see in this first slide, we're trying to focus on where is the hunger spots, hotspots, okay, where displacement and hunger collide. So you will find in the map here, okay, where is the major focus globally, and this is done by the studies always done in yearly basis between FAO and WFP, the both agencies responsible over food security. So you will find the priority now is Sudan, Palestine, South Sudan, Haiti, Mali. And the list goes on between, Afghanistan, Myanmar, Ukraine, Somalia, etc. So in this slide, you will see like the most severe hunger, malnutrition is literally connected with this displacement. So it's not just we talk about the floods or we talk about, for example, any other disaster or any other just social thing. It's mostly connected with conflict and with the displacement that's, caused by conflict. And you will see here that the displacement map, displaced families loses assets and routines and become highly exposed to price spikes, ration cuts. Host communities absorb the same inflation and the same service. The reality is shared distress, and that's why the response must work for host and displaced people. So this is a global anchor to keep the scale clear. There is no single official annual count of hunger, for example, this year, in the 2025, but the word telling us that 9 million deaths each year from hunger-related causes, with many deaths, recorded under infection or complications linked to undernourished rather than hunger on the spot on paper. So next slide, Malia. Why the situation is become catastrophic? You know, Politics and access set the ceiling. If access is constrained, even strong programs become, partial or and people fall faster. Then the daily mechanisms take over. Income collapse, price spike, risk is pushed down onto household. Families start borrowing, selling assets, reducing meals, taking, say unsafe work and increasing child labor risks and SGBV with the whole what we call the bad things happened when things get to go that direction. This is not a choice. It's forced sequencing when buffers are removed. So this is just um, part of why things getting catastrophic when we talk about food insecurity and we go from the level to where we reach hunger and displacement settings. Climate extremes add volatility. They amplify shocks and make recovery weaker each time. Aid itself should, you know, can be also instrumentalized in a conflict setting, used to punish, reward, control movement, or reshape behavior instead of being delivered purely on need when assistance become politicized and conditional in a practice. And it's also harm or it trust and undermines protection. And this is why here the key message on this slide is this is the resilience language, reliance language can become just unfair if it's ignored rights, documentation, safety, mobility, and predictable support. Slide 3, please. Yeah, we now want to focus on displacement now as a core hunger multiplier. We have based on UNHCR, we have 122 millions forcibly displaced by April 2025. And UNHCR is planning for 2026, which is we already there, for 136 millions displaced people in the globe. So we have expectations or projections of increase over 14 million extra, which is a bit scary number. And the expectation is this: most of these people will become, refugees or displaced just because of conflict. Majority of them, most 99% of them, maybe if not, let's say, not exaggerate, but the majority of them will be displaced because of conflicts. So here we're not talking about food security that's coming just out of normal situation of floods, droughts, or something like that, as a climate, because of the climate change. But most of these people will be the projection is goes a little bit beyond that to still remain at the highest level when in the conflict areas. Now, displacement, we know that it's multiply the hunger because it strips people from what makes coping possible. So land, tools, saving network, and a predictable work all just suddenly is gone. People don't have access to life-saving nets, and there's and their resources. It also adds barriers that standard plans often miss: legal right to work, documentation, discrimination, safety risks, disability access, child burdens, and movement restrictions. If these barriers remain, livelihoods support become a promise, people cannot reach. And any progress collapses after the next shock. What works is protecting basic needs, removing constraints, and shifting risks upward so households are not forced into debt traps again and again. Next, please. Now, part of the things I want to focus about in this presentation today with you and share what's going on in Middle East, and mainly the focus on what's still going on in Gaza, because last year with the Women Refugee Commission also I've been conducted a study on the impact of famine and starvation in Gaza on women and marginalized groups, and we had heartbreaking stories from there. Today, we want to focus on infant nutrition and the baby formula crisis in Gaza, for example, which is still remain even after the ceasefire, between two brackets there to talk about, but still the problem is there. Now, we have so far some. I want to share with you just highlights on this part, plus what you're seeing in the presentation. We have one indicator. In 5th of September 2025, WHO reported that there is 361 Palestinians had died due to malnutrition, including 130 children in Gaza. This is also context where food has effectively been used as a weapon through restricted access, distributed supply routes, and sustained collapse of the condition needed for survival. And when access is controlled, it can be instrumentalized, delayed, restricted, or channeled in ways that to punish or reward instead of being delivered purely on need. And the same thing is like accounts from Gaza last year captured the same patterns repeatedly: women going hungry so their children could eat. So we documented so many, many stories where they just boil, tree or leaves, and sometimes just water with some rocks just to make something. And so it was, as I said, heartbreaking stories about how women just starve themselves while they are all starving just to feed something to their kids. And it wasn't really working. It really like things went really badly. So the reality described was not just about long-term planning, it was about stretching tiny amounts of food, keeping children calm, making impossible choices while services and markets collapsed. For the infinite part, which is I want to shed lights on it today, is the risks become even sharper. Because infinite feeding is not just about also having the formula on a shelf, even it does not exist. This is the problem. So Israel does not allowing the formula to go in Gaza easily, and we are losing so many babies in Gaza now, day after day, because of just this formula. So maybe Hala will shed the light on it when we come to discussion. Safe feeding depends on clean water, functioning health services, sanitation, and also safe access to supplies when house basics are missing. Families are pushed into dangerous improvisation. So, in a nutshell, we want to talk on how many mothers also in Gaza, you know, um, framed it as a personal failure when it was clearly structured collapse shaped by restricted access, and problems in supply chain, destroy services on affordable prices, inconstant aid. This is not a resilience. This is survival under cohesive conditions, and women often absorb the shock first through the skipped meals, intensified care burden, and protection risks. This is why, before we move to the next slide, we want to flesh this, talk about this key message. You know, that the study we talked about in Gaza or what's going on under conflict is that the impact on the vulnerable groups, they were already vulnerable before the war. It's getting so much bad after or through the conflict. And if we talk about resilience, there is no resilience if the whole resources is gone or you don't have access to. Slide three, next one, Ali. Yeah, it's my last 2 minutes, and sorry if I'm taking long. Um, Now let's talk about the realistic pathway from survival to stability. I'm insisting to keep this in a priority, whereas like we talk first about access, protection, basic rights, and it's not enough to keep repeating access like 100 times, million times, and to be used and invested in all our advocacy collectively for people who cares about food security and hunger. So access is number one issue. There is nothing before access can be done. So access, protection, and basic rights without safe movement, function service, and a predictable human entry, resilience is capped. Second, affordability. Families need a workable daily, occasion, food support, and cash where visible. Plus real income options where markets and legal access exists. Third, shift risks upward, predictable shocks response, and rapid top ups after shocks prevented and spiritual and distress sales. And here we talk about the predictable, shocks that why we are not ready. We need to be ready somehow. We talk about it in the social protection. We talk about it in the climate insurance, how governments, agencies can respond when there is a predictable crisis. Fifth, livelihood only where conditions allow. Training is not substitute for safety, documentation, ability, childcare, and functioning market. So finally, last slide. Next, yeah, thank you. So this is like the formula of high-level agenda where I conclude my message. We need to push collectively for peace and humanitarian access across all areas of conflict that's going on in the world now. Without this, self-reliance become just rhetoric. Fund predictable multi-year sequences for displaced people and hosts, not one-year pilots that just end mid-pathway. And now even we want to think beyond these kind of modalities. It seems the world is moving from grants and charities to something else. We don't understand what is it yet. I'm also conducting a study now about these financing pathways for the next decade, and the whole world is a bit confused from what we are trying to see in our research. So, and we need also to scale up the climate responsive basics in hosting areas, especially water and energy, because systems strain and now is now driver of food insecurity. Resilience is impossible without peace and incomplete without climate action and risk sharing financing. So my final statement on this one, with thanks to Refugee Self-Reliance Initiative, Ali, for the host and for this beautiful, session, is that my keyword that I think we need to focus on because it's the whole thing is connected to peace, connected to access, conflicts, we also need to flag the issue of decolonization now. I think it should be our top priority for advocacy. It's like if there is always a reason behind the reason behind the reason, this is the mother of all reasons. So I'm really pushing the key message of decolonizing humanitarian aid, stopping wars, stopping conflicts, not fueling them, and calling for the peace is not like happening in another planet. It's happening in planet Earth by countries and forces we already know. So I think it's the time to call things by its name and calling for decolonization and peace building as a real agenda, as the only pathway for stopping this displacement in the first place that come with second to access to food, you know, and nutritional needs. Thank you so much. If you have questions, I will be responding. Over to you, Ali.
Thank you, Bilal, for starting us off with a great presentation and really setting the scene of many of the systemic parts of this topic and for giving the example of Gaza. Really appreciate your presentation, and we'll bring you back for the Q&A later in the session. So now we'll turn over to our panel discussion for today. Again, we have four great panelists with us. And our first two questions for the panel discussion will be round robin style. So I will call on each panelist to give us a brief 2-minute response before we dive deeper into today's topic. Starting with Hala, would each panelist please briefly tell us a bit about you and or your organization's work related to food security? Over to you, Hala.
Thank you so much, Ali, and thank you, Bilal, for starting us off today. I work in academia, so most of my work has focused on research, which aims to inform programs to improve food security, nutrition, and health. I've spent 13 years living and working in Lebanon during a time of rapid refugee influx and lots of overlapping crises. So that's the context in which I have the most experience. I've also worked in the contexts of Syria, Palestine, and Jordan. So I'll be speaking from that perspective today. My team and I have done a lot of work to document and track vulnerability to poverty and food insecurity, particularly in Palestinian, Iraqi, and Syrian refugee populations in Lebanon, largely to assess needs to inform targeting of programs. But I've also worked quite closely with WFP and other UN agencies and NGOs to evaluate interventions that were being implemented in the context of Lebanon and Jordan to improve the food security of refugees. And these have included evaluations of multi-purpose cash, the WFP Emergency School Feeding Program, as well as community-based programs that linked community kitchens to schools. And so, for example, for the community kitchens, we were able to develop a model for what we referred to as healthy kitchens in Palestinian refugee camps in Lebanon. And these were social enterprises that catered healthy food to local schools and basically had a two-pronged kind of impact, supporting women's livelihoods and children's diets simultaneously. And I'd be happy to talk more about our experiences with that model later on in the panel, as well as recent support for solidarity initiatives for displaced Lebanese in the most recent war, and then the implications of these kinds of models for self-resilience. Thank you so much.
Thank you, Hala. Next, we'll hear from Paul. Paul, you're on mute.
Good evening, everyone. My name is Paul. I work with the C Community Self-Reliance Network and working with the municipality of Nansana and Chira. From the outset, I wanted to sort of broaden my approach in this meetup because we are looking at refugees, but we work with more groups, for example, IDPs, migrants. IDPs are internally displaced persons, and then also low-income individuals like particularly women. And when we are talking about food insecurity, I think when you look at the SRI index, it cuts across all these different groups. So it ends up influencing the different domains. And at our organization, we introduce systemic inequality to enhance a more local, inclusive, and sustainable food system. In that way, I appreciate the fact that meeting up with so many practitioners in the area of self-reliance, especially with the refugees and food systems. And I look forward to sharing and discussing today. And very much thanks to Ali for keeping in touch and keeping us in the loop as we were preparing for this meetup. So with the municipalities, I wanted to give a personal experience coming back to the food insecurity. I think time flies so fast that we've almost forgotten the COVID experiences. It was something that wasn't prepared for, but in Uganda, like you've all known, we have different refugee groups, and the reasons for the refugee numbers and settlements are various, but mostly political, especially from neighbors around Uganda, that is South Sudan, Eritrea. We have some Ethiopian refugees as well. We have Somalis. Then we have DRC, that is Congo refugees. They are on and off all the time because we are in a sensitive part of the world where they are always fighting for minerals, and there are so many players in this area. So there's a lot of displacements in the southwestern Uganda. People keep coming in and going out, keep coming in and going out. But going back to my experience during the COVID period, it was a
Paul,
shock for
I might ask
yes.
you just to finish your thought so we can continue with this first question.
Yes, we had refugees looking for food. Yeah, they were looking for food to survive, and it hit me then that yeah, there has to be a solution. And thank God, you guys developed the RSI index, and we use it in our organization. To help us understand that food is a determinant across those groups I've shared. Thank you very much.
Thank you, Paul. Looking forward to hearing more about your experience in Uganda, and thank you for highlighting the role of COVID and how that impacted food security as well. Over to you, Tenzin.
Hi, everyone. I work with community organized relief effort, and I've been in the humanitarian space for about 15 years, spanning programs and research and advocacy. CORE is a humanitarian organization based in the United States, but we work across 5 different continents, delivering cash and market-based assistance. And we focus on emergency response and preparedness, health access, shelter, debris removal, livelihoods, and also climate change. So in my role with CORE, I support our local teams and our local partners to implement quality cash programming, using cash as a tool for food security outcomes, amongst other key outcomes. So we're a very data-driven organization, and we use a Self-Reliance Index to keep us on track, to inform real-time adaptations in our programs in Sudan, which I'll speak to today, as well as our other programs around the world, making sure that our programming is effective, inclusive, that we're leaving no one behind. And we implement multi-purpose cash assistance, group cash transfers, and livelihoods interventions to increase food security. And we backstop local actors in their existing capacity, including backstopping their meal capacity, often bringing in the index so that they can best support communities and households to stabilize after shocks and to contribute to self-reliance. Thank you.
Great. Thank you, Tenzin. Looking forward to hearing more from you as well on this panel. And our last response to the first question, John Francis, tell us a little bit about your work related to food security.
Hi, everyone, and thanks, Ali, for organizing this, convening this gathering. I'm John Francis Omsolo. I work for Masico as a regional market systems development advisor. And as an agency, our footprint is across different conflict and post-conflict countries, including Uganda, South Sudan, Sudan, Tanzania. You may wonder why Tanzania, but we work with formerly displaced people in Tanzania as well. We have the DRC, Central African Republic, Somalia, and Ethiopia. So across most of the contexts I've just highlighted, we have set our agenda, of course, backed by our framework. And of course, the first question that normally sets the tone for when we intervene is how do displaced persons, including former refugees, former refugee populations, participate meaningfully in local food systems. So the objective here is not just advancing food security simply as a humanitarian objective, but rather making sure that it's layered on a system. It layers the systems that help improve self-reliance, but also, of course, reduce the disproportionate suffering that we all know that displaced persons go through. So in Uganda, we have had experience working with refugees and their hosts, and of course, including them in agricultural markets that we have seen have moved those displaced populations from merely food assistance to being producers of the food, to moving into aggregators, and also engaging as small in Ethiopia and Somalia in the drought, of course, affected drought-prone zones, and of course, a heavily livestock-dependent ecosystem. We've seen our interventions around livestock strengthen and stabilize the markets, food especially, and energy, while we serve both the IDPs, as Paul had mentioned. Of course, we also have IDPs in both Somalia and Ethiopia. And then in Sudan and South Sudan, of course, we know those are really hot spots. The approaches are also really tailored towards making sure that the fractures that conflict has created are dealt with, but of course dealt with the lens of making sure that we are piggybacking on really longer term solutions, not just providing superficial humanitarian assistance. And of course, in Tanzania, as I had mentioned, it's really making sure that they are called naturalized Tanzanians, they're Tanzanians, but in a real sense, if you look at their context, they're not very far from still being, they're not even, I mean, you can't distinguish them and the displaced person. So they live in the same community, suffer the same problems, access, and the rest. So across the 5 continents, I mean, rather, the different contexts I've just highlighted, the strategies majorly is to shift from just food security, but rather transforming this to populations that are integrated into functioning food systems, and also viewing them not as mere beneficiaries, but rather economic actors who have a stake in developing those economies. Thank you very much.
Thank you, John Francis. Very interesting. And yeah, looking forward to hearing more from all of you on the different approaches in your contexts. And before we dive a bit more into approaches, I'd love to hear from everyone very briefly on if there are any other food-related barriers that you want to highlight before we talk more about approaches and strategies. So I know some of you already highlighted some, but I'll just give you the space to add anything onto that, starting with Tenzin.
Yeah, thank you. Purchasing power, supply, and gender inequality are at the top of the food-related barriers that we witness, excuse me, among displaced communities in Sudan and most of the contexts where CORE works. After a shock, especially in conflict settings and protracted crisis, we see families have fled for their safety, lost their source of income, sold off their assets, everything below was highlighting at the top. We see multiple rounds of displacement that increase vulnerability, especially related to food insecurity, which is especially grave for women and children. And cash and livelihoods programming is needed to help recover this purchasing power so families can afford food. On the supply side, in our rapid market assessments in Khartoum, we see shortages of key food commodities and rising prices for items like wheat, sorghum, millet, groundnut, and sesame oil, all produced within Sudan and neighboring states, but increasingly unaffordable in Khartoum. And the lack of livelihoods opportunities is most stark for women. Female-headed households in Sudan face severe food insecurity, twice the rate of male-headed households. And women and their dependents are hardest hit, have the fewest opportunities to recover due to gender norms and also the lack of gender responsive or gender transformative programming. So these are the key barriers that I'd like to highlight. Thank you.
Yeah, thank you for bringing those forward, so we can then talk about addressing them. Next, we'll hear from John Francis.
Again, thanks, Ali. From where we operate, one of the things we've seen as a key barrier to refugees and the displaced populations towards as they pave that journey towards self-reliance is basically that the context they operate is normally a context where markets are fragmented, and we all know that the basis for access to food and other essential needs is basically markets. And so the fragmentation in itself creates exclusion. And we've seen this firsthand across most of the markets we work in. And so if the desperation is that, yes, you may be able to provide some humanitarian assistance, but if markets are non-functional and fragmented, definitely that means there's not much that whatever assistance you've pushed forth will be able to do. And so we've seen this in Sudan, for example, where it's the active conflict zones. We all know how the consumer cooperatives there have tried to provide that. But of course, what we've also over time seen as we've been implementing in some of these areas is that as much as the displacement of households is, the displacements are critical. The challenge here is that the structure of markets is in most cases something that, like if markets are not structured, coordination functions are in most cases absent. So you find transportation is not there, aggregation is absent, and so that in a way affects how people access that food, but also drives the costs of accessing that food high. That means from both the persons who are providing the food to those who demand it, it all creates that burden. The other thing that we've seen is that we've seen limited access to productive assets within those areas. Even where policies are a little bit conducive, a classical case in Uganda, still critical access to land, for example, limits the ability of the displaced persons to produce any meaningful or surplus food that can be consumed, but also goes to the market. We've also seen scenarios where...
John Francis, I might pause you here so we can continue with our last two responses before we dive deeper, but please hold that thought and definitely try and bring it in a bit later on. I'm going to turn over to you, Paul. Briefly, what are some food-related barriers that refugees face in Uganda in progressing towards self-reliance?
Oh, yes, like Francis said, the biggest restrictions are most of the problems are structural, like land use. Refugees don't have access to land to use. And like Bella Jeju said, issue of documentation, like refugees are structured to be in certain places and not leave those places. They have an ID system, especially for those who are not in the urban centers. And they can't access markets. We have public markets all around in the city, but we don't have sections of those markets where you say this is stalls for refugees. So they've not been integrated in these market systems. And it's also about affordability, access, and generally the systems in place on the whole.
Thank you, Paul,
Yes,
for
thank you.
highlighting those additional barriers. And Hala, over to you.
Thank you. I was just reflecting on how many of these barriers cut across so many of the different contexts. I'll talk about Lebanon specifically quickly. So in this context, the first key barrier is there's been a severe economic crisis that was accompanied by extreme inflation. So the Lebanese currency lost 98% of its value against the dollar since 2019. And so this has fueled massive food price inflation in a context that is largely reliant on food imports, making not only refugees, but also Lebanese host communities more likely to face food insecurity and therefore having decreases in purchasing power, obviously decreases self-reliance. The second point that has been brought up as well, I think, is this idea of comprehensive refugee legal frameworks. The refugees in our context, and it sounds like in many of these other contexts, face barriers both to legal residency and legal employment. And so this pushes them towards informal, unstable work, if any work at all. And then obviously lower labor force participation is always a driver of food insecurity and lower self-reliance. And then third and finally, and this is specific to us, but I think it seems also, as I heard you talk about Tanzania, this is similar here. In Lebanon, the crises that the country has faced are not just affecting refugees. So large numbers of host families have experienced recent displacement. Many also experience poverty and food insecurity. And so this parallel vulnerability creates a lot of complexity. It strains public services, it increases competition for jobs, it heightens social tensions, and it makes policy reform really politically sensitive. And so I think efforts to expand these kinds of work opportunities, assistance for refugees have to be really carefully designed so that they also support vulnerable host communities. Otherwise, they risk undermining social cohesion. So from my perspective, the challenges are structural, they require political and economic stability, and then livelihood pathways and protections for refugees, but also for host populations that are living through similar conditions.
Great. Thank you, Hala. And thank you all for highlighting so many of those structural systemic issues that involve, much more than just the displaced communities themselves, but the host communities, IDPs, all these other groups. So for my next question, I'd like to start with Paul this time. Can you describe an approach to food security in your context that supports longer-term self-reliance beyond emergency assistance?
Yeah, when we are talking about long-term self-reliance as a food systems approach, we have to go all the way and include treating food as the entry point. Like I said, food is cutting across all domains of the SRI index. and we shouldn't rely on only short-term support like food support and cash support, but we should go ahead and put systems in place that bring refugees on the ground and make them part of the co-host host communities, like they take part in the production and the livelihoods. So, for example, I could suggest in Uganda we have what we call SACCOs. They're like sort of co-ops, cooperatives. But I think the refugees are left out. Actually, that's why we came up with the Greater Kampala Hunger and Food Poverty Survey, so that we can present this information to the Prime Minister's office, because it is the Prime Minister's office that handles refugee issues in Uganda. So they could also have a space where they are integrated into the market systems, and they could set up cooperatives such that they pool resources, they have access, and also as they are big groups, they get to use food as a cultural element to bring them together.
Great. Thank you, Paul. Thanks
So
for highlighting.
Emergency food assistance can be designed on the outset with a transition pathway toward income generation. That is the main thing. Yeah, like we have those systems in place. So in the long term, people get to feel they are part and parcel of the food system, the local food system, and they're also encouraged to add to it and also take away from it. Thank you.
Thank you, Paul, for highlighting the role of inclusion in food systems as a key issue here. Over to you, Tenzin. Can you describe an approach to food security in your context that supports longer-term self-reliance?
Yeah, absolutely. Totally agree with Paul on the emphasis on transition from emergency response to longer term self-reliance programming. In Sudan, with our local partners, we've been the first to implement early livelihoods programming and that transition, first piloting and now scaling up. This transition is essential not only to the common constraints that we all face, like less resources overall to implement these kinds of programs, the harsh realities of increased displacement, longer displacement, but for dignity and an exit strategy in and of itself to reduce dependence on immediate emergency assistance, to support local markets to stabilize, to contribute to security and peace as an underlying enabling factor of greater food security, and also to incentivize and sustain return. In Sudan, CORE with our local partners implement a modified graduation approach, supporting IDP households, returning households, and host community members. So, like colleagues witnessing that host communities are also really struggling, and being inclusive and targeting multiple populations in our interventions can address severe unmet needs, but also enhance social cohesion. Excuse me. So we implement multi-purpose cash assistance and also a tailored livelihoods approach. We deliver this alongside access to health and other services so we can boost human capital, help rebuild those assets, and enhance people's agency. We deliver cash grants to address basic needs paired with business and agricultural grants, technical training and business training to heads of households. But then within that same household, we provide vocational training and vocational grants to older adolescents, in particular targeting adolescent girls. So we support women and girls to access sexual and reproductive health care through health vouchers as well, enhancing their access to information, services, the opportunity to control their own reproduction. And these households also help cover costs in the short term, so the income that's being generated can stretch further towards food purchases and other basic needs. And we've seen an increase in self-reliance across 10 of the 12 domains through our program model, with statistically significant results in four: rent, food, debt, and savings, as well as the overall score. So we really focus our approach on being gender transformative, as a minimum, gender responsive if needed, to help break these cycles of vulnerability, marginalization, and food insecurity. And we're currently scaling this approach across several states in Sudan. Thanks.
Thanks, Tenzin. Thanks for highlighting just how holistic your program model is, and how you take into account the different household members in terms of gender and age in your approach as well. So my next question is for Hala and John Francis. How does food security affect outcomes in other self-reliance domains, such as employment, health and well-being, financial inclusion, safety, or social cohesion, and vice versa? What is the relationship here? We'll start with Hala.
Thank you, Ali. I'll refer to some of our data because I think it's important to rely on some strong evidence from the field. And just also, because I'm an academic, when I refer to food insecurity in our work, I just want to say that we largely rely on experiential measures of food insecurity, similar to the FAO Food Insecurity Experience Scale or the FIES itself. So in our work, we've conceptualized food insecurity as a key social determinant of health and well-being. And as a result, we have evidence from multiple studies that beyond its impact on reduced diet diversity, food insecurity in refugees in our context is also an independent predictor of reduced access to healthcare and of adverse health outcomes. And these include poor mental health, including depression, worse self-rated health, pain frequency, and then for those with chronic diseases, a reduced ability to manage their disease, including medication and routine follow-up for healthcare issues. And then on the other hand, and I've already alluded to some of the other self-reliance domains that affect food insecurity. So again, from our data, the strongest in our context is access to employment. So in a recent study of Syrian adults, we looked at the effect of some of these domains on both simultaneous, so at the same time, and subsequent food insecurity. And we found that labor force participation can halve the odds of severe food insecurity in the short and the medium term. Whereas assets, for example, were protective to a lesser extent, reducing the odds of food insecurity by about 20%, but then having longer term impacts. And then cash assistance and instrumental social support significantly alleviate food insecurity. So those are also domains of self-reliance. But their impact in our data are very much in the immediate and short term. So their effects are short-lasting, indicating that in our context of these recurring crises, refugees need continuous support from social protection programs and other sources of instrumental support. So they basically, the cash assistance is not enough to sustain them in the long term. And because the structural factors are not there for sustained improvements, then, it does reduce their self-reliance. So I'll stop there. Thank you.
Great, thank you. And we'll turn over to John Francis for the same question.
So I will talk through our work and evidence in Uganda and Ethiopia. And in terms of economic pathways, we've seen that improved food security directly translates into higher business profitability, because that means more time. The more food secure the households are, the more time they have to spend on more productive and more production-related interventions. And therefore, that means they spend less time and less resources going visiting health facilities to get medical attention or probably other related. But of course, we've also seen evidence that points that the translation of higher business profitability is not necessarily from the wage angle or the employment angle, and so that we know is connected to how the restrictions are within the displacement context. So that still is a key barrier. And our RCT results are due in April, and we've done an extensive RCT for both Uganda and Ethiopia. And so far, we are in the final stages of reviewing the final results. But so far, we've seen very positive outcomes. And then hopefully, we'll be able to share that once the final results are published in April. The other bit of it is that we have also seen that food security is a stabilizer of well-being. In a sense that consumption gains did not just raise spending, but directly reduce hunger incidents. And of course, once that happens, that definitely means that you will have much more productive populations. We've also seen gains around social cohesion and community dynamics, where if you have more improvements in health and in finance and safety through the savings groups that we've established, we've seen that there's that cross contamination between the hosts and the refugees, where of course that is a structural point where cohesion is supposed to happen. We've also seen markets play a key role in making sure that exchange of goods and services and people moving from here, and enhanced trade relations also improve that social cohesion and of course improve the general misconception that most times we say that the refugees or displaced persons are a burden on the ecosystem to which they find themselves settled.
Great. Thank you, John Francis. So, as we've explored, there's linkages with food security with so many different elements, including social cohesion, health and well-being, and so much more. So thank you both for illustrating that. My next question is for Tenzin and John Francis. You both have experience in practice approaches, including market systems development, graduation programming, and cash and voucher assistance. Can you speak to some pros and cons of these approaches as they relate to food security? We'll start with Tenzin.
Thank you. Hala said it well. Cash and voucher assistance is not a silver bullet. It's a building block of self-reliance, but alone it doesn't do the job. We have to look at not only a family's ability to afford food, but the supply side and access to that supply, as we've been talking about again and again. Often we see market systems development, graduation, programming, and cash and voucher assistance are delivered, but the interventions might be siloed rather than integrated or sequenced strategically. So the complementarity and sequencing of these approaches is really key to take forward and will have the most significant impact on food security. It's also not only these approaches, but the actors who are involved, who are platformed, who are resourced, who are leading. It's often INGOs that swoop in to implement these approaches. We need to learn first from local actors what's worked and support their leadership of these interventions. That also will translate into the greatest impact. Our value add in Sudan has been backstopping local actors who are already there, who have robust capacity to lead, and we assist in the areas where they want support. In some cases, this has been technical input. As I mentioned earlier, often it's in monitoring and evaluation capacity, either bandwidth or familiarity or both. When we link and can sequence cash assistance, graduation programming, and market systems development, we can see the efficacy of these together and help reap exponential benefits. Thanks.
Thank you, Tenzin. Really appreciate you not just speaking to the pros and cons, but the importance of sequencing and coordination here. Over to you, John Francis.
I want to agree with Tenzin 100%. Our experience as well in Sudan, in South Sudan, and where we've done cash and voucher assistance is this. I mean, it's essential at this acute phases, but like Tenzin said, it stabilizes, of course, households and injects liquidity into markets. And but on its own, again, it does not strengthen supply chain. So we need to make sure there's that coordinated effort at all angles. For graduation programming, of course, we know the ultra poor are always going to be excluded from the market spaces or from the opportunities, but then directly building their productive capacity and smoothing consumption, and of course, stabilizing their asset base. In the refugee context in Uganda, we've seen how immense that can can impact their livelihoods. We've also seen from the upstream, connecting markets strengthens the incentives, builds infrastructure, and also relationships that make food and markets more resilient and inclusive. So it's not in isolation. And just like Tenzin said, the mistake we've always made is that we choose between these approaches. It's that does not help. We need to make sure that the opportunity should be sequenced and layered on top of each other.
Great. Thank you, John Francis, for those additions there. My next question is for Hala and Tenzin. What programming strategies or principles are most transferable across contexts, including resettlement contexts, host country, camp or camp-like contexts? And we'll start with Hala.
Thanks, Ali. So I just want to preempt what I was just going to say in response to Bilal and the, his highlighting of what's happening in Gaza and what has happened. So I think what I'll talk about are probably principles that are transferable across many contexts, but the context of Gaza is exceptional. The complete blockade, the situation there, I think, really requires a lot of thought about what can be done. So I think I just wanted to say that I don't think what I'm going to talk about is transferable across all contexts. And I think that's something we really need to keep in mind as we keep discussing all of this is that there's a certain level of access and some stability is required to be able to move forward with this kind of programming or strategies. And I'll draw from our experience working with Palestinian refugees in camps and with Syrian refugees in informal settlements and host communities in Lebanon. So I think one transferable principle, as Tenzin mentioned, is pairing food and cash support with other sort of pathways to livelihoods. In our context, that would require systems that help refugees navigate the complex legal environments, as well as skills development and potential asset building opportunities to prevent households from cycling back into food crisis. A second principle that I adhere to strongly is working within and strengthening existing community structures. So among Palestinian refugees, there are long-established community networks that have been instrumental in implementing many of the programs we've worked with, particularly the Healthy Kitchens program. Among Syrians, we found social support actually predicted who could cope during recurring shocks. So I think programs need to recognize and build on those community social structures to be more sustainable and support social cohesion. And I think that can apply whether the setting is a camp, an urban neighborhood, or a resettlement context, but that requires the non-exceptional kind of contexts. And then finally, I think I would emphasize designing interventions that account for host community vulnerability, because again, in our context, the fact that both refugees and host communities have faced similar challenges, we really need to think about ways that are inclusive or at least sensitive to this shared vulnerability and therefore are more politically feasible and more sustainable. So for me, that principle is probably transferable to any fragile setting where displaced populations live alongside vulnerable hosts. Thanks.
Great. Thank you, Hala, for highlighting some of those strategies while also noting that they're not transferable, again, across all contexts, including places like Gaza. Over to you, Tenzin.
Thank you. Sorry. In Sudan, CORE and our partners in the Sudan Cash Consortium have seen complementarity of multi-purpose cash assistance and group cash transfers for food security outcomes, especially in the emergency phase. In this conflict setting with significant access constraints, the security situation is changing all the time. There's been proportionally low donor interest and commitment compared to need, and generally low international actor presence. relying on community structures, the Sudanese practice of nafir, mutual aid, has really been reinforced through cash transfers to community-based organizations. So this is included for core and for peer organizations, both local and international, the facilitation of group cash transfers to actors like the emergency response rooms and women's response rooms, as well as other community groups. And Takaya, or community kitchens, have grown across the country to be able to deliver life-saving meals to displaced families. Initially, group cash transfers were really leveraged to reach communities that couldn't be reached by more traditional humanitarian assistance, by multi-purpose cash assistance. But we've seen, as access has shifted and in continuance of both multi-purpose cash assistance and group cash transfers in tandem, that these approaches are complementary, not mutually exclusive. And together they can support access to food, help preserve dignity, enhance safety, enhance social cohesion. And I would go even further to say that an approach that's replicable is multi-purpose cash assistance plus group cash transfers and livelihoods programming, again, spanning, graduation and market system support. I think this is replicable in the various contexts that you've mentioned, Ali, and can really power charge both households and community-based organizations to lead their own recovery and enhance food agency. Excuse me. And the principles of our work are locally led response first, equitable partnerships, and innovation. Thanks.
Great. Thanks, Tenzin. Thanks especially for highlighting kind of the group community approach rather than an individual or household approach there. And also for recognizing the role of dignity in inclusion in this topic. Great. So I have one final question for Paul and John Francis before we turn it over to take some questions from the audience. So we'll start with Paul on this one. I'd like to hear what policy or other systems level changes would most strengthen food security as a pathway to refugee self-reliance. And in answering this question about systems level changes, how can municipal and local food systems in particular be leveraged in urban and peri-urban settings? So we'll start with you, Paul.
I didn't get the second bit of the question.
Yes, so asking what policy or systems level changes would most strengthen food security as a pathway to self-reliance? And in particular, how can municipal and local food systems planning be leveraged in urban and peri-urban settings?
Yes. First of all, like I said earlier, we shouldn't look at advancing self-reliance as just simple interventions like food relief and cash relief. We should have integrated systems. Like I was saying, in our municipalities where we work, like in Nansana municipality, they don't have any programming that integrates refugees. So it's like, but we have refugees living in the municipality. They are paying rents to landlords. So sort of they are benefiting the Nansana economy, but they haven't been considered as a part of the economy. Yeah? So food should be treated not only as an outcome of self-reliance, but as a deliberate pathway to it. And in that way, I think policy and programming should be from consumption to production. They should be able to set up policies that allow refugees to get access to land and be able to take part in productive operations, and also access markets. Like I said earlier, we have several city markets around the city, but refugees can only go and shop there. But actually, they could also do some selling. I met a refugee lady from Eritrea, and she was selling wine. It's made by her, wines, but it's not like an official platform. Like, she's not registered. She doesn't have a registered entity. So she's just doing it on a home basis. So they should be given the opportunity to have businesses registered. Of course, they will be paying taxes, but they are capable and they are able and ready to be part of the market and food systems. So municipalities should consider that and leverage those solutions and maybe even scale them. I've also learned from Tenzin. They work with communities setting up community kitchens. Here, I'm very sure Francis can agree with me. Most of the food outlet systems are churches and mosques. We don't have systems in place where people can have access to food in case they have food issues. So it should be put in, considered in municipal laws that they could have community kitchens that are supported by the councils, and also let private or individuals take part in supporting refugees and displaced people and those who don't have food to eat. Thank you.
Thank you for highlighting some of those different pieces here, and we'll turn to John Francis for the same question.
So thank you, Ali. I want to agree with Paul. First and foremost, I think our economic inclusion policies should be by default, not necessarily an exception. That, okay, yes, this is for this, the other one is for that. That shouldn't. Uganda globally is known for its progressive policies, but what the data tells us is that in the BDBD refugee area where we've implemented one of our graduation and poverty graduation and market systems push-pull approach, we've seen that overall access to land is very critical. And so even when we intervene and we deliberately target refugees and a smaller population of the host communities have resources, they have land, more land than the refugees. And so at the end of the day, the economic outcomes from the small incentives that the host communities get sometimes are like threefold more than what the refugees get because of that access. So we should begin to think, how do we make sure that we allow displaced persons to farm, trade, legally work, because that unlocks a lot and in the food systems realm. Secondly, I think partnerships with private sector and deliberate investments should be something that in the local food structures and infrastructure should be something that we prioritize. And we've seen investments in storage, investments in aggregation, investments in irrigation, access to energy, unlock a lot of barriers for displaced persons, but also linking towards really making sure that the food security outcomes are harnessed. And of course, we know that these investments that private sector if we de-risked investments with private sector, that means we'll have reduced volatility and will support that whole ecosystem, but not necessarily cherry picking and doing one of the other. The other third element that I've seen in our context that we operate in is the financial access. We know that's a risk area. Most financial institutions and most financial instruments are not designed for displaced persons because it's a high risk population. And so looking at it from that angle, in most cases, once there's no cash in the economy, and Tenzin here has demonstrated that already with cash and voucher assistance in some of their areas that they work in. Food actors operating in, of course, those fragile contexts, small traders, aggregators, are often too risky. That's what the financial institutions say. And yet, this is an essential component of resilience. So ultimately, food security becomes unsustainable when displaced populations are integrated into local systems and not treated as parallel systems. That's basically what that should be telling us.
Great. Thank you, John Francis and Paul, for speaking about some of the systems level changes that are needed, and including things like land access and integrating food security into all other systems as well at the municipal and higher levels as well. So this concludes the initial panel discussion. I'll now turn it over to one or two questions from the audience. We have just a few moments left here, and we'll bring Bilal back in as well. So one question from the audience, and this person was specifically asking about the Rohingya refugees in Bangladesh. So if any of you are able to speak to that context, that would be great. Otherwise, please bring in learning from your own context. But what role can vocational training, small-scale agriculture, and community-led initiatives play in improving both food security and long-term self-reliance? Would someone like to take this question?
I may take partially the question. This one. Um, Now, because we talk about this paradoxal, challenges and crises around the world, between climate conflict, etc. So my heart always goes to this kind of what we call it win-win projects and mindset of resilience and livelihood thinking. One of them is merging the climate change issue in it. For example, if we talk about the food systems and agriculture, and if we are adapting, for example, climate resilience agriculture, where is now many governments in the world, especially in global majority, they are focusing on trying to do something good. And if displaced people, especially refugees across the borders, engaged with a kind of activity that may ease what, John was talking about, easing the policy and, to try to integrate them in the community and to see the added value of what they are doing if we talk about this one. So from my point, I can see from experience now in a number of countries, even including Tanzania, Sudan, and Lebanon as well. So we need projects or live resilience activities that is really generating income. And any talking before the income is just like blah, 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 blah. It's nothing. Feed me first, give me income, then we can talk. Then I can hear you. So the idea is, if we talk about livelihood food systems, I'm a big fan of going for this kind of climate business model where people can have more production, cheaper at the input level, and may generate a little bit extra income. So this is the part one. And also it's more sellable with the government and host communities more than just another business. So we saw it in the different places. Like that's more acceptable as much as serving our community and our country. So this is just a flagship of um, the issue of livelihoods and income generation. The second part is, and this is on the NGOs and people who's pushing on the agenda, is the innovation part. Is like sometimes we have assumption that displaced people just don't know anything and they have lack of skills, or not the same thing with refugees. And all this assumption is killing the potential, not only just at the legal level, as the Hala said, they are not recognized, they are not allowed to work, etc., but also about their expertise too. So we had very strong innovations, and we saw examples by the UN system every year about refugees who's kicking off one, two, three, four, five, six innovations here and there. So it's good for NGOs in these countries to think about how innovation can bring, refugees and host communities to push something jointly. In Tanzania, we had something piloted for this. For example, a few years back, 20 Burundi, refugees and local host communities on, trying to find clean energy, for example, as they were not allowed to have, electricity and many other things that we don't want to talk about it now. It's somehow sensitive, but So, but I actually host communities where the Burundi refugees came together to work on clean environmental projects, both at the cooking level, and the value chain level when things come to energy. Yeah, thank you.
Thank you, Bilal, for that response to the question. And I have one more question. This one I'll actually ask to Hala. Could you please share a story that illustrates how food security enabled a refugee or household to make progress towards self-reliance? You're on mute.
Sorry about that. Yeah, I want to highlight the story of a women-led community-based organization out of a Palestinian refugee camp in Lebanon, Burj al-Barajne. The initiative or the kitchen is referred to as sufra, which means the table on which we serve our guests. So this was initially kickstarted through venture philanthropy. So this is sort of another means of sort of kickstarting and supporting refugee-led initiatives. And so this was one of the community kitchens that we worked with to deliver healthy school meals to Palestinian children in camps. But Sofra has since transformed into a small catering business. It runs a food truck, as well as a daycare center operated by extremely talented Palestinian refugee women who, when we look at what the impacts of being involved in such an initiative does, have increased their own and their community's food security, as well as their autonomy, their financial independence. They talk about a sense of self-worth, a sense of community, and improvements in mental health. So just a small example of women coming together, cooking together, and then turning this into a small business that actually serves their community. So venture philanthropy is one of the means potentially to kickstart some of these initiatives that then become sustainable on their own.
Thank you for sharing that great story and example there. And one more response from Paul, and then I'll wrap up the webinar. Go ahead, Paul.
Yes, in addition to Hala's story, I've seen programming in Australia and New Zealand. There's the Food Lab in Australia. It's an incubator. They bring refugees and all people together to fit in. They have a graduate program where they train them and then they assist them to reach out branding of their products. It's especially food, it's food. But they get that added technical bit. They brand their products and they are able to get their products on the shelves in the market, and they get access to markets, and they also get to mix with the locals. So, which is a good thing. On top of being a community kitchen, it has aspects of an incubator where those with skills of cooking can get to graduate and get their products to market. Thank you.
Yeah, thank you for sharing that innovative example as well within a community-grounded approach. So I'd like to thank all of our presenters for the extremely valuable insights you've all shared today across policies and programming. And before formally closing our session, I'd like to share a link for attendees today to fill out a quick 30-second survey about your experience engaging with the session. Your feedback will really help us to improve future webinars as part of the RSRI's 12 months, 12 domains COP learning series. So check out that link in the chat and please share your thoughts with us. We'd love to hear them. And then finally, I'd like to highlight some key takeaways from the event. We talked about how there's lots of different approaches, cash assistance, voucher assistance, graduation programming, et cetera, but that the sequencing of approaches really matters, and having, a multi-sectoral and tailored approach that sequences different strategies. We've talked about learning from local actors what's working, and working to scale that, as well as centering refugee expertise and innovation in food security systems. We've talked about considering climate approaches and the potential linkages there with income generation and livelihoods. We've talked about the most important piece of this, which is access and the policies around access, including documentation, freedom of movement, land access for refugee-led food production. And then finally, we've talked about the role of markets here, and interventions that are market responsive and that increase social cohesion with host communities. So again, thank you to all of the panelists for your great insights. We'll share out the recording and more resources on food security and self-reliance via our Community of Practice newsletter. So please be sure to sign up via our website if you have not already. Again, thanks for joining. Thanks to all of our speakers, and we look forward to seeing you all for next month's webinar, which will be focused on the relationship between education and refugee self-reliance. So thanks, everyone, and hope you have a great rest of your day.
Thank you.
Bye.